Hello guys, welcome back to my Instagram channel once again. So here I'm going to have a series of MCQ discussions. We'll go with one superb scenario-based questions. Let's try to dissect it. Let's try to understand it. Maybe a little bit long, not a short form of content, but we'll definitely learn something out of it. So I'm going to take a website called Webpath. You can just search in Google Webpath MCQs. They have amazing scenario-based questions. Whenever you're free, go and have a look at it, right? So now let's go to this question. So here you have an 8-year-old boy, at birth appreciated normal term baby, but his neonatal course was complicated by one of the important clue here, meconium right? So this baby had meconium at birth. That's one of the important clue. His sweat chloride level and trypsinogen are both found to be elevated. This is again an important clue. Elevated sweat chloride levels, sorry. Okay, throughout the childhood has experienced multiple increased bouts of pneumonia with productive coughs and Pseudomonas aeruginosa Burkholderia. This is a very, very classical finding. Pseudomonas pneumonia and Burkholderia cepacia pneumonia is kind of a characteristic finding for a disease called as cystic fibrosis. I never want you to forget this. This is something which I want you to remember forever. Right? Pseudomonas pneumonia, Burkholderia cepacia pneumonia. Think always of cystic fibrosis and an 8-year-old child presenting with meconium again a characteristic finding. Early presentation, so it has to be an autosomal recessive disorder. Just to recollect our tiny bit of genetics, what you know. So now let's go to the question per se. So we have understood what's the diagnosis. Let's see what the question is asking. So the question is, he's at greatest risk of developing which of the following pulmonary abnormalities? Cystic fibrosis and lung. One of the important things is pneumonia, right? By default, there'll be pneumonia. Adenocarcinoma, it does not increase the risk. That's nothing to do with lymphangiectasia or a pleural clog. See, pneumocystis pneumonia is not something which is characteristic of cystic fibrosis related, right? If it is an HIV/AIDS patient or any other of an immunodeficiency disorder, yes, definitely pneumocystis comes into play, but not for cystic fibrosis. Here, the primary action is the very thick sputum, which is going to just block the mucus thing and the pseudomonas and everything kind of overwhelms, right? Pneumothorax, no, but definitely yes, bronchiectasis. So the right option here is bronchiectasis. Recurrent pneumonia by default will end up in bronchiectasis, and this infection might be also lead to lung transplantation because it might destroy the entire lung, right? So tell me in the below section, which is the gene which is involved in cystic fibrosis, right? See you in the next video. Till then, bye-bye.